Hi, I'm Dr. Matson. Today we're going to be covering Chapter 28, Caring for Families, and this is in the Population Health for Nurses OpenStax textbook. So basically, today we're going to cover family as the client or patient, look at the different frameworks, talk about family health nursing and how to do a family nursing assessment, and then family violence we're actually going to cover later on in the semester. So, what are your goals? You should be able to compare different definitions of family and common characteristics, as well as trends and functions. So, just to start us off, I think it is really important for us to think about how intrinsic and important family is. So often we hear the negatives of it, and yet family is such a huge impact on our lives in so many beneficial, innumerable ways. So, just some quotes. So, the family here, so John Paul II said, the future of humanity passes by way of the family. And Albert Einstein said, rejoice with your family in the beautiful land of life. Mother Teresa said, what can you do to promote world peace? Go home and love your family. Michael J. Fox, family is not an important thing, it's everything. Walt Disney, life is beautiful, it's about giving, it's about family. J.K. Rowling, family is a life jacket in the stormy sea of life. So just a few, meaningful quotes to get us started as we talk today really about the intrinsic value that family has on our human dignity and our health outcomes. So we're going to define it. So how are we defining family? It's a group of two or more people, and it could be based on various definitions, right? But they're residing together, and typically we see this as either cultural, national, religious views. It has legal definitions, and caregivers, depending on what the situation is, could be biologically related to the children or not. The U.S. Census Bureau uses three distinct terms. So, family is a group of two or more people related by birth, marriage, or adoption residing together. A family group is any two or more people residing together and related by birth, marriage, or adoption. And then family household would be maintained if there is a householder who is in a family, and that could include unrelated people who may be living there. And just to pay attention to these legal definitions impact resources as well. So, the common characteristics of a family. There are theories that explain family characteristics and development. There's a popular family theory in the 20th century that focuses on stages of development and tasks that families go through. So Duvall's family development theory offers a similar perspective on growth and development to families. And basically it's saying that families must progress sequentially through certain stages and accomplish tasks together at each stage. And this makes sense if we're thinking about this in context of raising children, right? And they're going through certain phases and stages as well. And why is this important to you? Well, nurses use these theories really to guide their interventions, and they understand the context in which they're seeing, patients, whether that be in an acute care or in a school or in a public health office. And we want to be able to understand kind of the context of each family, know that they're diverse and different, have an understanding of cultural norms. And if we don't know that, then ask those questions. So what is a function of a family? So a family unit, as you know, in some ways, and we'll just, define these for our context, provide socialization. That's extremely important. How children are brought up in a family and how they're socialized within that family is how they're going to relate to the world around them. Also, it's that emotional support. If they can respond to stress and tension within the family, if they're modeled how to do that, then they'll be able to do that again outside. And then just practical support. So taking care of these societal and individual needs. Where do they play a role in the context of education, if it's sports, if it's art, if it's music? And they learn these behaviors. They learn how to adapt and be resilient. And these are really important skills for adulthood. So Maslow's hierarchy of needs shows that if the family is an integral part in meeting individual needs, right? So we can think of this in terms of food, shelter, clothing, these basic needs. And then the last one is self-actualization. So families really set this structure up to meet these basic needs and then to grow up and have that self-actualization. They seek out new experiences. These goals shift based on age. So in 2020, people living in coupled households, about 99% lived in opposite sex coupled households, while just 1% lived in same sex couple households. And this is according to the Census Bureau. Also, in 2020, roughly 88% of people in the coupled households were living in married coupled households as opposed to cohabitating. So this implies that most married couples are heterosexual. More broadly, married couple households of any type made up 47% of all households, and that was in 2022. In 2022, 10.9 million one-parent family groups were in the United States with children under 18. 80% of single parents were mothers, and 51% of them were never married. And 29% were divorced. In single-parent homes headed by fathers, 41% reported that they were never married, and 38% were divorced. In a divorce, there may be joint or sole custody. Involvement of both parents decreases burdens of the single-parent household. And we think of family with teenage caregivers, the rate of teen birth rates, even though it went down, is higher in the United States than other Western industrial nations. Birth rates among Hispanic and non-Hispanic Black teens were 2 times higher than that of non-Hispanic white teens, with American, Indian, Alaskan Native teens had a higher rate. And then in 2021, about 1.2 million same-sex couples were in the United States. That was around that 1%. And 710 million of these couples were married, 500 million were not married. And 31.6 of the LGBTQI plus couples were interracial, and 18.4% of straight married couples were interracial. In the United States, 0.5% of children live in a household with adults in the same-sex relationship. And we're going to just use all of these statistics to better understand the patient populations that we're working with and provide culturally sensitive, appropriate. So unmarried couples have increased in the United States about 8 million. That was in 2017. These cohabitating unions are more common among women with less than a high school education. They face or can face barriers. For example, in some states, they may not have joint health care benefits. Nurses need to recognize some challenges and help navigate and support these families. Foster families are different because the caregivers are not biologically related to the children. The state keeps legal responsibility for those children, which can affect decision-making and stability. Foster families often need more support and understanding from nurses, especially when they're addressing emotional needs of both the foster children and caregivers. So here we're going to take the example of Maslow's hierarchy of needs and apply it to a family. So I want you to imagine a family of 4 where the father recently lost his job. At a physiological level, the family is worried about paying rent and buying groceries. Their most basic survival needs are at risk. At the safety level, the parents feel insecure about losing health insurance, not knowing if they'll be able to keep their home. At the love and belonging level, there may be stress about money, which may begin to strain the family relationship. The parents argue more often and the children feel anxious. So here is where the nurse can come in, right? And this is by modeling communication, providing resources. Maybe that's to take care of those basic needs first. So it could be case management that will help connect to food benefits, maybe some grants to help with the in between for housing. It could be helping them apply for unemployment. And then we think of the esteem level, we could imagine that the parent may feel a loss of confidence because they cannot provide financially. So the nurse should support the parents in really helping with these community resources in order to take away some of the stress that is there and help them see that they can get through this process. And at the self-actualization level, once the basic and safety needs are stabilized, then they can start to focus on growth again. And then things like children excelling in school, parents being engaged in the family communities and activities, that will start to regain. So this is just an example of how nurses can really look at family health through Maslow's hierarchy of needs. So here we're going to segue, and by the end of this, you should be able to describe the socio-ecological framework, the transactional model, the general systems theory, the Calgary family assessment. So you're going to really be thinking of these frameworks. So the social ecological framework really looks at a range of social and environmental factors and intimate relationships that really affect the family unit. So we think of social networks. This could be work relationships, school affiliations, religious affiliations, and connections to other community organizations. Environment, that would look at the neighborhood, school, and community. And then when we think about this, we want to tie this into health promotion and disease prevention for families. The school nurse or the community health nurse is really positioned to help promote that. So if you're imagining like a family with a teenager who's struggling with obesity at an individual level, we're thinking of the teen's own habits like food choices, time spent on screen, those things that can affect health. At a relationship level, family routines and support matter. So maybe the parents encourage healthy meals, or on the other hand, they don't bring home fast food as often. On the community level, the school plays a role through the lunch program. So is the snacks in the lunch provided healthy, or is it more like fast food? Physical education opportunities, so team sports. And then think of social networks like friends, after school activities, how those also influence behavior. And then on a broader environmental level, we're thinking, okay, is the neighborhood safe? Can they go to the park? Can they go to the grocery store? Can they walk around? So by applying this model, we're thinking about how it's really shaping family practice, policy, peer influence, community. And then this is what is informing the design of that health promotion strategy. For example, like connecting the family to community-based programs and interventions that can help them make healthier routines and choices at home. And here's an example again of it, just this in practice in terms of this model, really engaging all of the different people in the family. So providing nutrition education and information on where to obtain healthy food in the community is another example of using this framework. So the transactional model, so the model considers relationships between family members and between families and the outside organizations as reciprocal. So members of the family both influence and are influenced by others. And then within the family, the nurse can use that transactional model to examine really the relationships between the caregiver and the children's behaviors. So families go through different life cycles or stages. And when the family interacts with these institutions outside the family, this is using this model. So community nurses, they can use this model to see how the family transacts or interacts with other people or a group. So we want to think about how they can build these healthy models outside of the family. So how are they acting at their sports teams, their practices, right? Their plays, different groups. So it could be at a religious organization or at a scouting event or et cetera, et cetera. So we're thinking about how they're interacting outside of their family. So this general systems theory, this is interdisciplinary, it's conceptual. And it's focusing on individual entities or systems that relate to each other and organize within systems. So what does that mean? Well, let's break it down. So the individual is a system that exists within and among other systems that influence. So we think about this family as a system, right? And it's comprised of those members whose thoughts and beliefs and actions influence it. And then the family, in turn, is influenced by other systems, for example, environmental, educational, economic, political. And when we think of that, we want to really think of it in terms of how these outside influences are impacting the family. So if we think about this, let's give an example for this general systems theory. A nurse is working with like a 15-year-old adolescent. They just got diagnosed with type 1 diabetes. So on this individual level, the adolescent must learn to monitor their own blood glucose and administer their insulin. The family level, we need to understand what are their beliefs about food, health, medical treatments. How is that shaping how the adolescent is managing their condition? So even if we think of a sibling's eating habits and attitudes may also impact adherence. On a larger level, the family is influenced by the educational system, so school nurses, meal options in the cafeteria. Economically, what can they afford in terms of insulin supplies and food? Healthcare system, what is their access to endocrinology and nutritional services? Environmental, right? We're thinking about these outdoor spaces. And so when we think also, how does someone feel, right? How do they think and feel about disease, this chronic disease that this child has? Are they trying to ignore the fact that they don't have? Do they think, oh, this is something you can overcome in your mind? So all of those beliefs are going to impact whether or not they can adhere to their medication. So the Calgary Family Assessment, so family interventions is used by nurses to promote health and functioning and address family illness concerns. So these were developed from clinical work and then applied to nursing practice. So it's looking at the family structure and development and then function to look at strengths, resources, problems, and illnesses. So when we think of this, it's really targeting family functioning as a whole. It's based on 3 domains: cognitive, behavioral, and affective. And effective interventions really incorporate all of these 3 domains. And nurses explain rationales, so that would be the cognitive domain, when teaching new activities that lead to behavior change. That's the behavior domain. And families who implement the behavior change incorporate it into their family functioning, and that's the affective domain. So there's a proposal that it's a 15-minute family interview, and then the nurses can use that interview in a variety of settings, which then are going to inform how they can target these cognitive, behavioral, and affective domains. So now we're going to switch gears, and by the end of this next section, I want you to be thinking about how you can examine family health and individual health, and then look at identifying health promoting characteristics and self-care for health promotion, illness prevention, and illness management. And then always think of this in terms of where does that nurse's role in the community play a part. So family health affects individual health, right? That's kind of the context for what we're talking about here. So we think of family nursing, it involves caring for one patient, one client in the community. We need to take care of all of them together when we're even just addressing the health of one. So we can work in various settings as family health nurses. This could be in home care, it could be in the clinic, it could be we see advanced practice nurses, right, in the working as nurse practitioners. It could be in the government or in the hospital. And even if we think about the people who, if you want to go into pediatrics, you're going to have, yes, your patient, but you need to address the entire family when they're there. They're all your patient. So family health really reflects the ability to meet the individual's needs and the family member's needs. And there are a lot of external influences that impact family well-being. So characteristics of healthy families, right? So researchers have really identified characteristics that reflect strength and health of families. So they have affection, right? They care about each other. They have commitment. So they're reliable, they're there, they show up for each other. They have positive communication, right? And this could be in all the little ways, right? When you're stressed or tired, but those communications are positive. And strong coping skills. So did someone get sick, right? Or did they lose a job? Or even on a smaller level, what are the day-to-day stresses of running around to all of the different sports activities and taking tests? Do they have a sense of healthy spiritual well-being? And this is important too, right? To balance everything as well. And at the really core of all this too, are they spending time together? So all of research has identified these key things as having these characteristics are in healthy families. So families play a central role in health promotion, and community and public health nurses are important providers in these interactions. So one framework often used is the health belief model. So this model is recognizing the need to change behavior by looking at beliefs and about health risks and benefits based on those beliefs. So a collaborative approach works best when used with families. So nurses partner with the families, they can help them understand and navigate health issues more effectively. Education can take place in a variety of settings. So this could be schools, clinics, workplace, or even at the home. Health promotion also works across 4 levels of prevention. So primordial prevention is really focusing on preventing risk factors from ever developing. For example, like encouraging eating habits that are healthy in children. Primary prevention reduces risk by promoting immunizations or physical activity. Secondary prevention really is identifying problems early through screenings like mammograms. And tertiary prevention helps families when they have to manage a long-term illness, such as supporting, let's say a teen, like we said, with diabetes, type 1 diabetes, or someone who's had stroke. And when we look at these different levels and they work collaboratively, we can see how families and communities really strengthen together through this education and support with the community health nurses. So here is an example of a nurse providing health education and prevention strategies to families and communities at a community health fair. So when we think of home visits, so home nursing may be complex and sometimes it's unpredictable. People may have to cancel their appointments based on what's going on at their house. They need to be able to face health and safety hazards. So OSHA has compiled resources for identifying and preventing these hazards in home healthcare, and each visit needs to be planned, and there has to be an identified intervention that only a nurse can perform. This can range, right? So we can have people doing visits in pregnancy or postpartum to someone who is post-rehab for a heart issue or stroke. So there really is a variety of within that continuum in which a nurse can do a home visit for. Okay, so now by the end of this, you should be able to differentiate between a genogram and an ecomap, develop one for an ecomap, construct a genogram, and apply the nursing process to really understand this holistic view of family and formulate a plan. So tools a nurse may use during an assessment to establish nursing care and plan and really get a holistic perspective on family and their needs could be what you're looking at here. So this genogram. So this is a visual depiction of a family. So you can see that there are lines drawn to show connections and relationships among members. So that's the genogram. And when we look at it, families or their social network, that's the ecomap. So what is a genogram? So it's really a diagram showing birth and marriage relationships among family members. Usually it's over 3 generations, and it can include health information. So an ecomap, when you guys are looking at one, this is also known as an ecological map, right? It's a visual assessment tool that illustrates the relationship between family and the social network. It helps nurses identify areas of conflict and challenges within a family, and then be able to assess where the nurse can be able to see where there's positive and negative influences, and then from there target interventional needs. So this is, you can see here, an example of this eco map. And then from here you can see, if you're looking at Tyrone, how he's being impacted by his family, friends, teachers, employers, neighbors. And then if there's, positive or negative influences there, from there interventions can be developed. So a family health assessment is a systemized process of collecting and organizing data. It determines strengths and areas of concern. Interviewing is really a really essential part of gathering data. And then after the family health assessment is complete, nurses will formulate a nursing care plan. And then these care plans consist of, assessment, diagnosis, planning, intervention, and evaluation. So you know that this assessment part is the data gathering phase. So that's where those family interviews would come into play. And then from there, it could be analyzed. So they're going to look at the data, see what the priorities are needed within that family context, look at the community settings, and then plan and implement. So are there realistic goals, feasible interventions that are needed to carry out that plan? And then the intervention. And then did it work? That's our evaluation, right? So we look, did it work within that family? Sometimes things are more cyclical, than linear. So it may take a few iterations for it to show. Thank you.